Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk about a book I'm listening to right now. It's one I've heard of in the past. I've just never really listened to it. It's called The Checklist Manifesto. So if you haven't listened to it, you can get it on Audible. But it's a great book, and it what I liking about it was it's a surgeon from the Boston area. He's like a cancer surgeon, and he kind of talks about the importance and of using checklists. And specifically, he's talking about line placements within the ICU and how they can reduce infections by doing just some simple processes like with a chlorhexidine scrub and sterile technique and drapes and things like that can really reduce the infection and death rate within these hospitals. And he's talking about the importance, but also the difficulty of getting doctors on or nurses on to be using these checklists, because a lot of times they just don't have enough time. They're just way too busy. But it helps them to just do things in a certain order and just to make sure that things work well. So as I'm working through this book, it's really what I found. And if you know about me, I've been doing these checklists for a number of years, and I've made these available. If you guys haven't looked at them yet, it's within the patient presentations thing within Podiatry Practice Mastery. So you go there. First thing is these presentations, and the presentation isn't the checklist. The presentation is the PowerPoint on the diagnosis. But then what you find is the last slide, or the last slide after the presentation, there's a checklist. And I've made these checklists for everything that I treat: plantar fasciitis, onychomycosis, neuromas, everything. And a lot of them you just copy and paste them because they're very similar. But what the checklist does, and this is what he affirms in this book of the Checklist Manifesto, we sometimes get distracted, or we get busy, I'll just give it a simple example. So I had a student rotating through. She is opening a nail salon, and then she's doing this MediNails course to be certified to maybe do diabetic nail care or cancer patients and things like that. So I'm sitting there teaching her and kind of walking her through things and helping her and explaining things. And I find that even I forget things when I get distracted or when I get out of my normal zone or organization of how I do things. So we do things the same way every single time. Something very simple as when I do nail care, I usually go from the patient's left foot to the right, so all the way my right hand side, right hand all the way over, and then I'll do the calluses. That's just the order I do things. And so I did the nails, and I was teaching her something, and I forgot to do the callus. I know that sounds like something real simple, but it's just because I was distracted. And many times we get distracted in our practices with things that happen. Maybe the patient asks you a question, or your staff interrupts you. That's the benefit I like of the checklist. And so I have these checklists that I've been using for years, and they really help when I have someone come in. Now, a lot of times the first visit, I'm not going to do everything in that checklist, but this checklist is this is everything that I can do for them. And for me, it's about 99% of patients, they get better with those treatments. It's just a matter of which ones we're going to do in what order. And that's the benefit of the checklist. Also, it makes it more objective versus subjective. And that sometimes can help us, because when we're seeing them, maybe not the first time. So you see is the checklist, and then it's going to have also this I got from everyone in the past. They talk about protocol. So basically, after the checklist, I put what I potentially would do the first visit, second visit, or third visit. I put those. I kind of break up the checklist into different pieces. But if they've come in 3 or 4 times and you've tried a lot of different treatments, I find the checklist makes it very objective. I can look at it and say, okay, Mrs. Jones, you're not getting better. Let's look here. And we say, well, have you been doing your foam rolling, your stretching? Yes. Let's talk about plantar fasciitis. Yes, I've been doing that. Do you have pain when you get up in the morning? Yes. You've been stretching? Yes. Have you tried the night splint? No. Okay, that's something we can try. It's on my checklist. Have you done physical therapy? No. Okay, well, let's do that. And a lot of times what the patients will do, they'll say, well, what is that thing that says velocity? Or what is that thing that says walking boot? Or what is that thing called shockwave or amnio? They'll ask me about these things. And so if we've tried these other treatments and they're not better, and we have the correct diagnosis, which is key, or they'll ask me about an MRI, I can then do an MRI, do a velocity brace, I can do a cam boot, things like that for them. And a lot of times they're asking me because of that checklist. So I would, you might want to consider if you can work it into your into your treatment plan. It's kind of a pain to learn to do something new or have a new flow of treatment. I would be happy to kind of talk you guys through that. If anyone wants to chat with me, I would just make a strategy session. Go to Podiatry Practice Mastery, make a strategy session. I'll talk you through it. I'd love to have some other people doing these, or at least trying these, maybe just on one diagnosis. Pick plantar fasciitis and try just the checklist. You don't have to use the whole presentation, but just try it. See how it works for you. See if it makes it easier for you. And tell me if you'd be adding things to them as well. So anyway, that's my thought about the checklist Manifesto. As I continue to read, I will share more information from that. Okay, guys, have a great day.